Perfect. So we are here with Cam. We're going to be doing another Fellows in Focus here. Welcome, Cam.
Thank you. It's great to be here.
Yeah, so this is our chance to really kind of get to know fellows as in a different light oftentimes than we see clinically. And as faculty, I think for me, it's really enriching to kind of get to know people outside of the
Yeah.
halls of UMMC, et cetera. So we'll just to kind of kick things off, love to kind of get a sense of your background, your upbringing, and sort of how you grew up.
Yeah. So I actually grew up in California. Somehow I've made it here to Minnesota. I grew up in California and just north of San Francisco, in the Bay Area, but in a pretty small community called Muir Beach, by Muir Woods, which is a national park that a
Oh
lot
yeah.
of people visit.
Hmm.
Um, and so I had this great opportunity to be near San Francisco and in the Bay Area, but also in a really small environment where I could hike and be outdoors at the beach a lot when I was a kid. So a lot of fun.
Cool. And then what stimulated your interest in medicine and then by extension hemonc?
Yeah, so both of my parents are psychologists, so they're sort of and scientists. And so even from a young age, that was sort of something that was part of my life, science and medicine. And then I really knew when I was in high school, when I took my biology classes in AP biology, that this was something that I was really interested in learning about how cells work in the human body. And going through college, it was similar. And the only intricacy or difference for me too was knowing that I also really liked research. And so having a combined MD, PhD, and doing medicine and science was really what I was drawn to.
Cool. Yeah, and you've been very successful with that. We'll circle back to that, but I kind of wanted to first before we get there, you gave up the beach life
Yeah.
in the woods of Northern California for Minnesota. What made you come here?
Gosh, it was a long time ago that I made that decision to come first for college at Carleton, and then come back for medical school and graduate school training. And it was, first the being in Minnesota, where near my family, my mom's family is from here, and then coming back for medical school and doing my medical training was again partly a family decision, but also just loving it here and knowing that it would be a really good environment for me to do my sort of undergraduate medical and graduate school training.
Cool. Yeah, I mean, I'm not from here either. I grew up in Tennessee, so I think the perspectives and getting very, sort of very far away from the regions that you grew up in are really valuable. And then you can always go back
Absolutely.
and
Right.
you sort of know where you're going, but it's that sense of, in the same ways the Southeast US is very different than Minnesota. I would have to expect that Northern California is as well.
Yes, and I don't think Northern California and the Southeast U.S. are similar either.
They're
So it's
not.
sort of an interesting kind of overlap as well.
Yeah, that is true. So tell me about your research. It sounds like you got started early, and obviously with the MD PhD, there's a lot of it.
Yeah,
But
yeah,
kind of give us a sense of what you've worked on in the past, or more importantly, what you're working on now.
yeah. So even as an undergraduate and before I went through graduate school, my something about who I am, how my brain works, is really focused on the regulation of the immune system, and especially in the context of when things go awry, which we see a lot in medicine: autoimmune disease, inflammatory diseases, allo transplant rejection, etc. And so that early on in the context of asthma and differences between kids actually early on that had asthma and didn't, and what changes were part of their T cells and their regulatory T cells in particular. And I carried that forward into graduate school and into now looking at immune regulation in the context of graft versus host disease. And using and understanding regulatory T cells as a potential therapy for that. And then moving forward, actually thinking about using those same cells, which are both immunosuppressive, but also highly functional tumor killers, and using those cells actually as CAR T cells. And so that's where I'm now, and then moving into hopefully more so in the future.
That's awesome. With that pathway, right? There's particularly if I think about like where you were back at undergrad and sort of just
Yeah.
trying to learn about the immune system, but like we don't learn about that even at that level very much. You know, you've experienced a lot of mentors, I presume, mentor
Yeah.
plural, down the line. So who would you consider your mentors over time, and what have you learned from them? Because you may learn different things from different people.
Yeah. Oh, that's a great question. I really lucky to have had just excellent mentors and people that I really connected with. First, when I was doing my research in the summertime at Stanford with a allergy immunologist, Kari Nadeau, who was an MD PhD, and then really here at Minnesota with Bruce Blazer, also a physician scientist. Those are my two really main mentors over time. Certainly, I've had contributions from other people that have had important pieces. I think the biggest thing that I've been able to take away, or one of the most important things that I've been able to take away from both of them, um, is that initially you really have to love it. And these both of them have been doing it for decades, research and medicine, and that it's okay if things don't work out the first time, the second time. That that if you really love it and it's what drives you, using those. I don't want to say failures, but those opportunities where you don't necessarily succeed to build and look back and become better every time is really important. And that's medicine and science.
Yeah, it's hugely, especially, if I think about the research and being an assistant professor, and sometimes something that sounds really good, particularly if it's in my case patient facing directly, and it just falls flat for reasons that were unpredictable at the time, doesn't mean it's a wash. It means
Right.
it means that you learn from it and it's valuable. But sometimes there's that expectation that everything you do is going to be publishable right off the bat, and whether it's that or you get the project and it gets declined, right? Those things
Yep.
happen too.
Yep.
And that there's a lot to learn from all of that experience, and
Yep.
just humility being one of them.
Absolutely.
But I think it all
Absolutely.
sort of molds it. Do you think that the summers in Stanford working with a physician scientist really, or the MD, the MD PhD, really got you going towards the lab? Because I mean, obviously, different people have different experiences, take them different ways. I did lab research and fellowship, and then I said,
Mhm.
this is not for me. I want to do clinical stuff.
Yeah.
So
Yeah.
I was curious that because that's a really early taste of it.
Yeah. No, 100%. Definitely. Um, it was, gosh, it was such an informative and experience that really molded me into who I am today, at least in part. Just being able to see her go literally from the clinic, bring blood samples from the patients that she saw that day to us in the lab and work on those, and being able to do it at the same time. And that was really exciting for me. And it cemented not just my interest in medicine, but in research, and um, my desire to do both.
Cool. What are your career plans post fellowship?
My interest and focus right now is on bone marrow transplant, stem cell transplants in general, and thinking about cellular therapies. And so, being in an academic institution and being able to move forward my own research at the same time, and see patients in the clinic and the hospital, and be able to work with trainees like myself. I've, like we've talked about, I've had great mentors, not just in the lab, but in the clinic, on the clinical side in particular too. And I want to be able to give back and be at an academic center with people like me.
Yeah, cool. And then if you sort of extend that 10 years down the road, is this something where you see yourself in that uh core basic science, or in that translation where you're actually bringing your therapies to the bedside, or somewhere in between?
Yeah, I'd like to. Well, certainly, I think we have. I envision doing things in a stepwise fashion.
Yeah, yeah.
Lab research and bench research is so competitive in terms of getting grants and big grants. So I need to make sure that being able to have that sustainable over time is a focus. But I do ultimately hope that we can bring some of what we're doing in the lab back into the clinic, and that's certainly an ambition of mine, is that I can be part of the clinical trials, and be the impetus for clinical trials based on what we're doing in the lab as well.
Yeah, it's really exciting. I mean, hearing what you're doing and just knowing from my background, even not being in oncology anymore, just the rapid growth, the excitement, the ability to think about the immune system essentially in a totally different way than, if we think about this is like a second in the scientific
Right.
clock. And
Yeah.
we've said, okay, well, rather than fighting the immune system, we're going to harness it, right?
Yeah. Absolutely. We think about checkpoint inhibitors on the solid tumor side, CAR T cells and NK cell therapies, both in our liquid cancers, blood cancers, and even into the solid tumors as well now. So yeah, exactly. Harnessing the immune system, getting it back on track in a
Yeah,
way is
exactly.
a next forefront.
Rather than like pushing it back the whole time, it's like, all right, come on with. All right,
Right.
we'll ride along
Right.
the train
Right.
and just steer
Tweak
it in the
it.
right direction.
Yeah.
So,
Yeah. Exactly.
um, this takes a lot of work. This is a, fellowship, especially, but just especially in your path with this science as well. So it takes a lot of support. Tell us about your support system, in sort of that, uh, whether it's science or just outside of the halls of the building. Yeah, sort of the day-to-day support you have.
Yeah, I'm really lucky to have just a wonderful family. My wife, who is she's a pediatrician, pediatric hospitalist fellow, and so she's been we've been together a long time, and she was there when I was doing step one and studying in medical school, and then I saw her do the same, and we've been together, fortunately supporting each other through finishing medical school and residency and fellowship now. So it's a wonderful to have a partner who understands what you're uniquely going through. So she's been wonderful, and we have two kids now. So that's busy, but it allows me to try to separate from work and be at home and have home time, which I think we all need to decompress, even if it is busy with two little ones. And then I have my parents, my brother, all of our extended family, and being in Minnesota allows us to see a lot of my wife's family and some of my family as well. And that's really the focus and support that I have, not every day, which is great.
Yeah. And I have two boys as well, and it does get easier once you're done with fellowship. When you have control of your own time,
Absolutely, I
uh,
hope so.
it does get a little bit easier. um, if you weren't a physician, what would you be? Or if you
Well, I think I can cheat a little bit, because I think if I didn't do medicine, I would still do science, which
Okay,
I'm already doing. So
that's fair.
if it weren't one of those though,
Yeah.
um, gosh, I it would be hard to see myself outside of of science in some capacity, but um, hmm, that's a tough question. I would still be a researcher if I didn't do medicine, but
Got it.
I think that's a cheating answer
It's
too.
at the core right there.
Yeah, exactly,
All right, one
exactly.
last question. This is a fun one. if you were a travel agent and you were trying to sell me on anywhere in the world that I should go, where would it be and why?
Hmm. Oh, and where are you located? You're in Minnesota?
Yeah, yeah, yeah.
Okay,
Said another way, where's your favorite place that you would go, or maybe a place that you
sure.
want to go?
So we used to go to Hawaii as a kid. I love going to Hawaii. Maui in particular is someplace that I've always loved, and it's just such a being from California, it was easier
It
to
was
get to
easier.
than a little bit easier than Minnesota, but it's such a wonderful, relaxed environment, and being able to feel like you're away from as much as possible in the real world. But I would also advocate for a tour around Europe, France, south of France, into Italy, maybe up into the Alps as well. Just again, such a beautiful environment, being able to see unique uh, historical perspectives as well. So I don't know if I sold you on those, but those are two places that I love that I would go back again in a heartbeat.
Yeah, and I love this. We've been to Hawaii a little bit. One thing I love about Hawaii is, and particularly right now with Mauna Loa erupting,
Right.
is like you really are seeing the earth change in front of your eyes in a place that you really don't see in most other places. Maybe if you're near a glacier, but even that you don't see it changing in front of your eyes like we do right now.
Absolutely. And the reminder that humans are but tiny, tiny fraction of the history of our planet and the universe, and the islands, the creation of our continents is ongoing over many millennia, more so than we've ever been part of.
Yeah, and one thing I think about in terms of Europe in general is I mean, the history just goes back so much further. Sorry about the glare there. Than anything we have
Right.
in the U.S. And
Absolutely.
maybe like if you're in New Orleans, you get a little bit of that feel of it.
Hmm.
And if you're in if you're on the East Coast, you get some of the older buildings, but they're still centuries younger.
Oh, right.
And just the
Absolutely.
fact that they're still there, right? The fact
Yeah.
that this has so
Yeah.
much history. If you go, I remember going in Spain and it was in places where these towers were built by the Moors in like 1200s, and you're just like,
Right.
wow, like this is
Right.
still here.
Yeah. Yeah.
It's
Absolutely.
crazy. Like,
No, I feel the same way. Just the entirety of the buildings in our continent are younger than so much of Europe. It's a fascinating dichotomy for sure.
yeah. So will you be at Ash?
I will.
That's
I'm heading out on Friday morning.
got it. Any presentations?
Yep, I have a poster Saturday night, and I was lucky to get an Ash Abstract Award this year.
Awesome. Congratulations.
Yes, thank you.
That's wonderful. I'm looking forward to it too. I'll be there Friday to Monday. So,
Yeah, it's the first in-person Ash that I've been to in fellowship.
huh? Yeah, exactly. They were all otherwise COVID or half
Yeah,
and half
exactly.
and stuff
Half
like
and
that.
half. Yeah, exactly.
Yeah.
I'm
Well,
excited
good.
to go
Well,
back.
I know, and New Orleans is a fun one to be at. Some of them are more fun than others, I guess, but
Yes.
they're all just fun to see colleagues, to get, to see ideas being generated around the world that either align with what you're doing or are different and thought provoking or frustrating. One of the two, can be lots
Yes,
of different ways. But
absolutely.
just the idea to hematology oncology is a small community when you start to get into your niches, and so but at the same time, to see 30,000 people at a meeting is really
Right.
fun.
Yes, absolutely. Absolutely. Walk the expansive meeting halls
Yeah,
of
New Orleans is just
New
a straight
Orleans.
shot all the way
It's
down. You just keep
yeah,
going.
huge.
I remember I had an oral abstract when I was a resident, and it was like at the very end, and I was like, and I went in the main entrance right by the closer to the Superdome, and I was like, this is a
Right.
long walk.
Yes. Yeah, that New Orleans when I was a grad student was my first ASH, actually, many years ago. And then I had the opportunity to do a couple more in grad school. So this will be an interesting look, it's come full circle, and many more, I'm sure I'll have an opportunity to go to in New Orleans.
Yeah. Well, thanks, Cam. This has been a pleasure. And it's, I love just kind of getting to hear about stuff that's going on in the fellowship that I don't necessarily see very often. So thanks
Well,
again.
thanks for having me. I'll see you at ASH.
See you at ASH. All right.